Thank you, Baran Khan, for your very kind words, also for co-directing this event. And also very, very special thanks goes to Professor Necmettin Pamir, long time mentor and a very important figure in not only in Turkey, Europe, and all over the world. And I'll thank you all participants being here today, Saturday. You can spend time with your family, but this is something we love. This is the love of neurosurgery. Wherever neurosurgery comes, we are there. So thank you for being all here. I'll start my talk. I'd like to thank other distinguished speakers today, Necmettin and Hüseyin. I am originally from Turkey. I live in Madison, Wisconsin. Currently, I practice here. I have no disclosures. And this is our lovely city. Madison is built in the isthmus of the Three Lakes. We welcome all of you guys here whenever this pandemic gets over. And of course, this is the meeting for Rhoton's Turkish fellows under the auspices of Acıbadem University. This is the best picture of Dr. Rhoton. I loved him. So approachable. Anytime you ask something, he wouldn't dismiss you. He will answer his best. He will do his best to answer your question. And it's truly very nice human quality. So when he's teaching, you can see the joy he was having. And that's a very important feeling for his followers. So again, we are very, very, very grateful to him. I'm sure he's watching now from somewhere. So I'll start with just my concept of posterior transpetrosal approaches. I think anterior transpetrosal approaches is covered in a separate talk. So these are the approaches going through the mastoid bone or petros part of the temple bone for lesions involving the mostly petroclival region. These lesions are usually difficult to access via conventional neurosurgical approaches like retrosigmoid approach, which is the workhorse of the neurosurgery. There are three main types of the posterior transpetrosal approaches: retrolabyrinthine, translabyrinthine, and transcochlear approaches. There are also so many modifications and different combinations of these, and you can perform these as a pure retrolabyrinthine, translabyrinthine, or transcochlear approach, or you can combine with the others. But the whole idea is accessing the ventral part of the brainstem without significant retraction or traction on the cranial nerves and the brain. Retrolabyrinthine itself, it's approach to design to preserve the hearing, but it is very limited approach. And limited presigmoid posterior fossa approach, also limited the middle fossa, and you have to transect the superior petrosal sinus. We like to perform this when patient has an intact hearing or serviceable hearing. Translabyrinthine approach, you are going one step further, more anterior ventral approach, and then you are removing the semicircular canals and the vestibule. So you are sacrificing the hearing if hearing is present, but usually we like to do this approach when there's no serviceable hearing or hearing is so borderline, you know that you are going to lose the hearing anyway. Transcochlear approach, another step forward, we are going more ventral again. And this time, the function, I wouldn't say sacrifice, but function you are risking is the function of the facial nerve, because you are drilling more and you have to transpose the facial nerve. ENT colleagues call this a long transposition. And then when you transpose the facial nerve, you are taking the periosteum and that kind of devascularize the nerve in a sense. And then patients wake up with the significant facial weakness. It may improve, but it's not going to improve better than the Hausen-Breckman grade 3. So anytime you do something, you are taking some kind of function or you are risking the function. And there are combined approaches. You can combine these approaches with the anterior transpetrosal approaches or middle fossa subtemporal approaches. And there are so many of them. The main thing is getting ventral to the 7 and 8 complex, ventral to the 5th nerve. And if you drill more, you're going to get more, but you are also risking losing the function in some of these approaches.